So good morning students. Today we are going to discuss about the disposition of peritoneum. We will start with the general features of peritoneum. So first of all, this is the anterior abdominal wall. If we see the layers of anterior abdominal wall from outside to inside, the first layer is the skin followed by fascia. You have already taught about the fascia, the superficial part which is fatty, and a deeper part which is membranous, followed by muscle layer. So there are 5 muscles in the anterior abdominal wall, the lateral muscles and the 2 muscles in midline. The lateral muscles are, as you can see, the direction of fibers. This is the external oblique muscle along with its aponeurosis. If we reflect this, if we reflect the external oblique muscle, then you can see the direction of fibers just 90 degree to the fibers of external oblique. This is the internal oblique muscle along with its aponeurosis, which is forming the rectus sheath. If we cut and reflect this muscle, then you can see the transversely running fibers, which is the transversus abdominis muscle forming the posterior rectus sheath in most of the part. Then remaining 2 muscles are present in the midline. This one is the rectus abdominis muscle, which is running from the 5, 6 and 7 costocartilages to the pubic symphysis and brachii. So this is the rectus abdominis muscle along with its intersections. This is one intersection. Then if you cut and remove the muscle, you can see the posterior rectus sheath, and also if you see carefully, here you can see the arcuate line where all the aponeurosis are present anterior to the rectus abdominis muscle. Then there is one small muscle close to the lower part of the rectus abdominis muscle, which is pyramidalis, which is arising from the superior surface of the pubic bone, and it is inserting into the linea alba. So this one is the small triangular muscle known as pyramidalis. Here also you can see this muscle. This is the pyramidalis muscle. See the fibers running towards the linea alba. This is the linea alba, and the fibers are running towards the linea alba. So after these muscles, there is fascia transversalis and extraperitoneal fat. Fascia transversalis, extraperitoneal fat. See, this is the extraperitoneal fat and the parietal layer of peritoneum, which is covering the anterior abdominal wall from the posterior-most aspect. So if we give a cut in the posterior abdominal wall, we enter into the peritoneal cavity. So we have already cut the peritoneum, the parietal layer of peritoneum, and you can see the contents of abdomen. And if I put my hand between the organs and the posterior-most aspect of the anterior abdominal wall, my hand is in the peritoneal cavity. Okay.